Ladies and gentlemen, Assalamu alaikum. I'm going to tell you something about the rainy season which is going in our country. A lot of rains, the air becomes humid, there are vapors, and when there are vapors, is a problem which is called as the fungus. It is very much common in my spy, you see E.N.T specialty. The ear is having some problem like itching, like obstruction in the ear, and sometimes it gives start a pain in the ear. I tell you very frankly, fungus is a nuisance, especially those children or the young people. They go and start taking bath in the canals. You can see in Lahore, I am here. I have got a clinic, my own E.N.T hospital on the J Road. And just near that, there is a canal, and opposite to me is KUALALUMPUR College. People come from there, they start jumping, they say that we got pain in the ear. When I examine the ear, there is a fluffy mass, just like cotton. And practically, if it's white, it is Elba; if it is black, it is called Niagara. If these are the two varieties which I see commonly. I'm a practical man because my E.N.T, Rana E.N.T hospital is just near the canal on the jail road, opposite to KUALALUMPUR College. I got maximum patients. I've got a lot of experience, and it's very bad disease. If it is not treated properly, first it causes, obstruction. Then it causes pain, and the third, complication is perforation of the eardrum. It is going to perforate. The eardrum is having a hole. Then it becomes a nuisance. It is very difficult to treat. We have to do, oral toilet, that is cleaning of the ears, suction clearance, then putting the, various, drops, and some tablets also, sometimes we have to give. But it should be handled nicely. When I went to Dhaka, Bangladesh, it's a very much common problem there because there is a lot of hard humid and there are rivers. You can see this photograph. I'm standing there in the Sheraton Hotel Dhaka. That E.N.T conference, they discussed this problem, that how we can manage. It's very nuisance, bad tendency to recur. It has got, patient is okay, again he will come, again doctor problem ho gaya. Then I went to, New Delhi for 5th SAARC E.N.T conference, where I did the candle lighting ceremony. It was a big event. Top most people, the Health Minister of India, Rana, then Admiral V.K. Singh, DG Armed Forces Medical Services of India, then the President of E.N.T from Nepal, Sri Lanka, they all were standing there. It was a big event. There were about 5,000 E.N.T doctors sitting there. I had a chance to address also to those people that all this area, Pakistan, India, Bangladesh, Sri Lanka, in the month of July, August, September, this is the rainy season. The fungus is prevailing. Whenever a patient comes, he should be treated, with a great, force, that one should not take it casually. It's a nuisance. To treat the fungus needs a lot of work. However, then there was a delegate from Nepal, Professor Rakesh. He said that we do the proper cleaning, then some medicines, local application we do. Fungus later, if it is not treated properly, it was told by the Professor Venkat there in India, the E.N.T conference. I had a discussion with him there in this ASHOKA Hotel. Then I went with Professor Deka, who was the president of AIMS, All India Institute of Medical Sciences. It is the biggest hospital, referred hospital of the whole India. Patients come from all over the India to that hospital. And Professor Deka, who is the dean, and he's the top man of the hospital, which is catering about 40 provinces of India. The patient come there, they were handled very nicely. I was very much impressed from the system of All India Institute of Medical Sciences. I have not seen such institute anywhere in the SAARC countries. Very huge. And New Delhi is itself a big place. It's a federal capital and a state capital. However, they are nicely doing the work. I visited along with Professor Decker, who was a top man there. He took me to his operation theatre, and then I went accompanying person in the surgery theatre of AIMS in E.N.T. He did operation for a deaf child for cochlear implant. Really, he did marvelous surgery. I have seen this surgery there in Washington, New York, and London also, but he did better than those people. He finished it in 35 minutes. Then he offered me a cup of tea in his office, and very nice person. I must appreciate his hospitality and surgery also. He said, okay, when you want to come again, come and I will teach you, train. We are not that miser people that people should not learn from us. He was very nice. However, I then saw the surgery, cochlear implant. Then I came to Pakistan. I told to my colleagues in Pakistan also now cochlear implant is in the, you see, that stage. Okay, now there are centers in Islamabad, also in Lahore, in Children's Hospital, or other places where this cochlear implant surgery is being performed. However, later on I will tell you something about this deafness problem, that if there is a perforation in the eardrum, we can repair the eardrum very easily. This operation is called as laryngoplasty or tympanoplasty type 1. And if there is a problem in the chain, that's the ossicular chain, that's Malleus, Incus, Stapes, if they are, you see, injured or they are not doing proper, we can do the ossiculoplasty. These are the various things which we can see also in Malaysia E.N.T conference that was called as 10th Asia OCEANA E.N.T conference. There was a special chapter on deafness, and they gave me the responsibility, hearing for all, and I accepted the challenge for Pakistan. You can see there is a big gathering, and then for that I have worked in Pakistan, and Mr. Ibrarul Haq, the top singer of Pakistan, he came to me and he said that I want that you should have a free medical camp there in Sahara Trust Hospital, Sugra Shafi. Yani Sugra Shafi Hospital works under the Sahara Trust. Then I went to Narwal along with my team, and Mr. Ibrarul Haq with his brother Major Israrul Haq and DC Narwal and MS of the Sugra Shafi, they, you see, received me and took me into the hospital. They showed me the hospital. Then I did a medical camp there. I have seen lot of patients there, gave them free whatever hearing aid and other, you see, possible medicines. Then they also asked me that, Doctor, can you suggest? I said that, okay, you go on doing something good. You are sitting in a very down, in far-flung area, that means Narwal is near to the Indian border. It's not that in the central Punjab. It's away from that. And you go on doing work. Whenever I will get a chance, I will come again and do the free medical camp, because we have to serve the humanity also. However, after that, the DCO Narwal, he took us to his DCO house in Narwal and offered us a very good, you see, lunch. We enjoyed his hospitality and then came back. I will tell you very frankly, hearing for all is my slogan. I am working on it, and inshallah I will remain working on it. Thank you very much.